Ladies and gentlemen, please welcome the Executive Vice President and CEO of the American Academy of Pediatrics, Dr. Karen Remley.
Good morning. I just have to say, is this not a great day to be a pediatrician and a fellow of the American Academy of Pediatrics? It's just amazing. So I am delighted we have as our keynote speaker today one of our very own Academy Fellows and a member of the New York Chapter 3, Dr. Richard Besser. As ABC's News Chief Health and Medical Editor, Dr. Besser provides medical analysis and reports for all ABC News programs, including World News Tonight, Good Morning America, 2020, Nighttime, and This Week with George Stephanopoulos. His weekly health-focused Twitter chat reaches millions of people. A pediatrician and infectious disease specialist, Dr. Besser travels the world to cover major medical news stories. In 2014, he walked the Ebola wards in Liberia to report from the center of a deadly epidemic and continued to provide extensive coverage as cases were seen in the United States. Dr. Besser came to ABC News from the Centers for Disease Control and Prevention, where he was director of the Coordinating Office of Terrorism Preparedness and Emergency Response. He also served as the CDC's acting director from January to June 2009, and he led the CDC's response to the H1N1 influenza pandemic as the government's chief health spokesperson. Dr. Besser continues to volunteer as a pediatrician with the Children's Aid Society in New York City and is a distinguished visiting fellow at the Harvard School of Public Health. He has received many awards for his work in public health, including the Surgeon General's Medallion for his leadership during the H1N1 response, and the Dean's Medal from the Johns Hopkins Bloomberg School of Public Health. As a medical journalist, Dr. Besser has received an Overseas Press Club Award and 2 Peabodys. But the distinction that no doubt has the most meaning for him is that he is the only EIS officer to go out to an outbreak and come home with a wife. Richard met his wife, Jeannie, a food writer, while on his first outbreak investigation in 1991. They have 2 sons, Alex and Jack. I've been very lucky to have known Rich for close to 20 years now, connecting with him along the way as both he and I have taken on new roles and responsibilities. As our careers have progressed, Rich and I have maintained the same commitment to individual and population health and to the Academy, where he serves as a member of the AAP section of Epidemiology, Public Health, and Evidence, as well as our section on infectious diseases. No matter what avenue he pursues, journalism, researcher, educator, or public health administrator, Rich never loses sight of his idealism, his enthusiasm, or his capacity to perform those acts of loving kindness of which Bernard just spoke of. But then he is, after all, a pediatrician. Ladies and gentlemen, please welcome our colleague and Academy Fellow, Dr. Richard Besser.
Thank you, Karen, for that very nice introduction. And thank you, Dr. Dreyer, for just an amazing president's speech. It's a true honor to be here in San Francisco addressing this audience. I give a lot of talks, and each day when I'm on the air for ABC News, I'm addressing millions of people. But I have to tell you that addressing this audience is truly special and wonderful. And I was telling Janet and I know each other from Hopkins. She was a fellow when I was a resident. So the connections are just amazing. But I was more nervous about giving this talk to a room full of pediatricians than I am when I go on the air at Good Morning America. You know, each of us is here because we care passionately about the lives of children and are trying to make an impact in children's lives in different ways. And What I want to do is make a case for you this morning as to why I think media matters as a way of trying to make those connections. The theme that we're talking about today is about connecting. And my goal isn't to turn you into a room full of TV doctors. There aren't enough slots for that. But I would like it that the next time a journalist calls you and wants your opinion on a topic, that you take the call and you think, wow, this is a way that I could actually get out a message to the community that could make a difference. Since I'm a journalist now and a storyteller, I'm going to tell a bunch of stories. I'll show you a couple clips because that's what I do now. And I'll give you a bit of a look behind some of the craziness that is television news. So the first story I want to talk to you about is something Karen brought up, and that was the Ebola epidemic. 2 years ago this month, I was in Monrovia, Liberia. It was my second trip to West Africa to report on this outbreak. And when I worked at CDC, when I started there, I was an outbreak investigator. And so I've seen outbreaks of disease all over the world. And what I saw in Liberia was unlike anything I had ever seen. It was the most devastating outbreak, an overwhelming situation that was not being addressed adequately. And so I felt it was very important to be there, to try and tell the story of the people that I was seeing, to make a case to the American public as to why US resources should go to helping control an outbreak in a place that most Americans had never heard of. And so I just finished doing a live hit for Good Morning America. We were up on the top of the telecom building in Monrovia. It gave a great view of the city. It kept us away from the crowds. It was a great place to work. We'd had a difficult time that day with the feed. When we'd arrived at the telecom building, the people there weren't very excited to see us. They'd been watching some of our reporting and seen that we'd been going out into communities where Ebola was being transmitted, and they started to view us with a little suspicion that we possibly could be bringing Ebola into their workplace and cause problems. And so we were starting to think about, okay, where can we report from next? So I got into our SUV, me and my producer, Adam Desiderio, and our driver, and we took off to go back to the hotel. And as we rounded the corner onto the main street heading back to the hotel, there was a big crowd. And they were gathered on the sidewalks on both sides of the street. It was slowing down traffic. We weren't sure what was going on. During the midst of a communicable outbreak, crowds are not a good thing. So we pulled over, Adam grabbed his camera, and we got out to see what was going on. And there was a little pharmacy there. I went over and was talking to the pharmacist, and he said that people are very mad. There was a member of their community who'd been sick for several days, and they tried repeatedly to try and get him some help, and no one came. And then he died. And they were very upset that they weren't getting the resources that they needed. And so we attempted to do what we could to tell that story. So take a look at this video.
Here in the street of Monrovia, there's a body here. Maybe Ebola, maybe something else, but the burial team has come. They're busy spraying down the area where the person is. They're going to wrap in plastic and take away. But I was talking to someone in the community, and they had someone sick here yesterday. They didn't think it was Ebola. They thought it was something else, and they called for help, and no one came. They called again, and no one came. And not until he died, a 37-year-old man, not until he died did they come. And then they called, and within 1 hour, the burial team is here. This is a place right now where if you die of Ebola, they're very quick for you. If you're living and you need help, there's really nowhere to go. He's not dead. He's not dead. They were wrapping him up to take him away, but he's alive. He's moving his arm. They almost took him away to the crematorium. and they notice he's moving his arm. I don't know where they could take him. There are no hospitals to treat him. Now the first responders, the ambulance is here. They're trying to get them to stop to take him and to somewhere where he can get some care.
Exactly.
Yeah, but it's not clear yet whether are they here for him or they're driving by. They're going to take him. The problem that they have here is that there's a lot more room for dead bodies than there are for people who need treatment. So when they thought he had died, it was very easy to come and collect him. But now the ambulance is here, they have to find a bed. And beds for treating people with Ebola are very scarce here in Monrovia. So the crowd is not happy. They want him taken right now to somewhere where he can get care. It doesn't look to me like he's going to be able to make it. Very few signs of life. But for them, he's a member of the community and he needs every chance that they can give him.
So that was 2 minutes of television. And before I started work at ABC News, the idea that you could communicate anything in 2 minutes, I thought was just a non-starter. But now when I'm on the air, 2 minutes is often a luxury. I'm sometimes on the evening news given 30 seconds. But the power of an image and a character and a narrative is something that can pull somebody into the story in a way that quoting statistics cannot. And as an epidemiologist, for me, it's almost sacrilege to say that statistics don't really resonate because I live for statistics, but they don't. And what I've learned in television is that you have to take those statistics and disaggregate them down to an individual, into a person, into a story, into something that people can connect with. So I want to step back and tell you how I got into this situation. I'm an accidental journalist. I never had any interest in going into television or media. I've had a lot of different careers over my lifetime. I was a residency director. I've been an epidemiologist. And I'd been working at CDC for a long time, pneumonia, antibiotic resistance, emergency response. And then in 2009, when President Obama was inaugurated, I was made the acting director of the CDC. And when I took the job, when they called me and said, "Do you want to be acting director of the CDC?" I said, "Yeah, that sounds great." I said, "How long will I be acting director?" And they said, "Well, you'll be acting director for about 6 weeks." And I said, okay. He said, "But during that 6 weeks, you can treat it like you really are the director of the CDC. Yeah? And do anything that you really want as the director of the CDC." So I'm thinking, this is terrific. I can try this out, see what it's like for 6 weeks, and then I go back to my job. Well, it didn't exactly work out that way. Tom Daschle was supposed to be the Secretary of Health. His confirmation went up in flames. And so instead of being the director for 6 weeks, I ended up being the director for 6 months. And that was a big difference because in April of 2009, the swine flu pandemic hit. And it allowed me to step into a role as a communicator that I otherwise would not have been in. Whenever there's a new outbreak, an outbreak of an emerging infectious disease, there's certain things that you do. You do disease detection, you investigate clusters, you do surveillance, you develop guidelines for hospital infection control. All of these steps to try and ensure that you understand what's going on and you're providing guidance. But one thing that we did that was a little bit different was we put a big focus on communication. And it's been known for a long time that communication is one of the biggest drivers of trust. As pediatricians, we know that. We see it every day when we're in the office with a patient. That communication, that emotional connection is what helps a parent believe the advice that you're giving and follow through with that. And we wanted that to be part of what we were doing as well. We established our strategy, and it was that influence and containment was not possible. The outbreak was already spreading. It was in multiple places in the United States. We would direct all of our actions towards mitigating the impact of this swine flu epidemic on people's health. We would take aggressive action until we knew that we could back away from that. We said that we would share what we knew when we knew it, and we would tell people what we were doing to find out the answers to those things where we didn't know what was going on. We would direct our actions towards those things that were expected to have the greatest impact, and we would base those actions on the best available science. We wouldn't wait until all the science was in, which is really what we like to do at CDC. We would take steps when we had limited information, and we would change that information as we knew more. And we told people that they should expect to see different things in different places. We talked about a shared responsibility, that there were things individuals could do to protect their health. There were things that doctors and families and schools and churches and communities needed to do. And then there were things that the government would do to protect people's health. And every day we would hit those messages over and over again. I did a press conference every day and answered people's questions. Every morning I was on the morning talk shows. Every evening I was on the evening talk shows. And I want to show you an example of that. Whenever I look at this, I cringe a little bit because there were some things I did well and some things I did not do so well. And so I want to show you an interview that Diane Sawyer did with me at that time. It was probably the toughest interview that anyone did with me while I was acting director. Let's show that video.
Cases, as we said, have been diagnosed inside the U.S., mild cases so far, and yet 35,000 Americans die every year from other kinds of flu. And this created a lot of confusion about the government's use of the word emergency when talking about swine flu, a question I put just minutes ago to acting CDC Director Dr. Richard Besser. Dr. Besser, thanks so much for being with us this morning.
Good morning. Thanks for having me.
I want to get right to the confusion people have here. It's been declared a national health emergency, and yet people are told they can still travel to Mexico. You can still go to big group events. No one in the U.S. is being told to wear masks as they're doing in Mexico. Is it an emergency or not?
The declaration of a public health emergency allows us to do things that we otherwise wouldn't be able to do. There are a number of things that people can do and can do today as they're getting ready to leave their homes to reduce the likelihood that they'll get sick or that they would cause other people to become sick. And so that is one of our steps in being aggressive and leaning forward, given that with any outbreak, we don't know what the next day is going to bring.
Do you want to say to people this morning, the word emergency used by us does not mean alarm for you?
What I want people to understand is that we're concerned. People should be concerned. There are things they can do to reduce the likelihood that they'll get sick. We'll tell you what we know when we know it, and we're being very aggressive at trying to understand and control this outbreak.
How afraid are you personally, just from your experience and intuition about this flu as you're seeing it now? How afraid are you there'll be deaths? How afraid are you that it's going to become an explosive event in this country?
You know, I am not reassured that we have not seen more severe cases in this country. From what we understand in Mexico, I think people need to be ready for the idea that we could see more severe cases in this country and possibly deaths. That's something people have to be ready for, and we're looking for that. So far, thankfully, we haven't seen that. But we're very concerned, and that's why we're taking very aggressive measures.
Let's talk about what people can do. If you're saying, go ahead, go to your group events. No, you don't have to wear masks. It's just washing your hands and trying to stay away from people who seem sick?
Well, those things that our parents told us when we were little, washing your hands, covering your coughs and sneezes, staying away from people who are sick. And yourself, if you're sick, don't go out to work, don't go to school, stay away from crowded places. Those things will reduce the likelihood that there's spread to other people. Now, if you're a confirmed swine flu case, the guidelines that we've put on our website today will help health departments and the public understand what they should do.
If it's of grave concern to you what's going to happen next, why not do more at the borders? As we know, in some countries, they're already testing people for fever as they're coming through the airports. And yet at our borders, I understand it, they're simply being asked, how do you feel?
Border control is something that's used to control the entry of many types of diseases. It's much more important before there are cases within a country. We have cases here in 5 states that are not contiguous. And so a border control strategy as a means of not letting something into the country would not be very effective.
So you're saying it's already here. At this point, putting a further break on the border won't help?
You know, what we're saying here is that we do have this in our country. People need to be aware of the signs of this. If they have those signs or symptoms, they should be tested and they should be treated appropriately. And we should implement the measures at the community level that will reduce the likelihood that that will spread further.
But why not do more to seal the borders or at least test people, even for fever at the border?
You know, what we're going to be doing at the borders, and that will be taking place starting today, is doing passive screening, asking people about fever and illness, looking for people who are ill, and handing out cards that let people know what's going on in Mexico, what's going on here, so people can take action to protect and prepare.
You think that's enough?
I think that is the appropriate measures at this point. But as I was saying, every outbreak is different, and I would expect that our guidelines will continue to change as we learn more and as we look at what are the most appropriate measures to take based on the existing information.
Thank you so much for clearing it up. Very helpful, and thank you so much, Dr. Besser. Thank you.
Thank you.
Every time I watch that, I break into a cold sweat again. And that was the short version. As I was preparing this, I pulled up the clip, and there's actually a version that's almost 3 times as long. She kept going and going and going. And a few things about this. Okay, so when you're called by the press, people say, oh, we should always partner with the press on this issue. Never view the press as your partner. There are times where your goals and the goal of the media are in line, but that's not always the case. And so you want to be ready. You want to stick to your talking points. You never answer the question, how afraid are you, or what's the worst thing that could actually happen here? And so you definitely want to have some training around this. So I did interviews like this every day, and we had polling that was being done by Harvard School of Public Health, and they actually found that people's trust in government was going up and up and up during this outbreak. It was as high as it had ever been seen during a public health crisis. People's knowledge about what to do, staying home, washing their hands, covering coughs and sneezes, was also going up and up and up. And so when the permanent director of the CDC came in, and I was trying to decide what I wanted to do next. I had a number of things I was thinking about. I could take another job in government, I could take a job in academia, but a couple television networks had reached out to me and said, you know, we liked what we saw during swine flu. Would you, I don't think they saw this clip. Would you be interested in joining as a correspondent? And you know, I thought that was kind of funny. I didn't get my news from ABC or any of the major networks. That's not where I go to for information. But as I thought about it, and the goal of trying to impact on people's lives, I realized that there are millions and millions of people who do get their information from the mainstream media, and that there were no pediatricians who were on network news. There was no one with a background in public health, and I had an opportunity to try and practice public health in front of a camera. And so that's what I do. So each day, I try and give people information that they can use. And when you think about the problems that people face, you know, obesity, cancer, heart disease, violence, guns, so many of these things have a behavioral component. And if you can give people information to allow them to make better decisions about their health, perhaps you can impact in their lives that way. So when I'm on the air, I don't do that many pieces like that Ebola piece. Most of what I do is I'm on the air and I'm talking to the anchor. And the anchor is the stand-in for the viewer, and I'm there as the doctor. And I'm given usually in the morning about a minute and a half to 2 minutes. I'll talk to about 5 million people while I'm doing this. And my thought is that hopefully over time people develop a relationship with me and they trust me. I would love some of the academic pediatricians or people in schools of public health to study that and see, is there really any impact from health information from the news media? And there's so much work done on looking at the impact of violence on television and in movies, but I would love to see whether what I do makes a difference. So here's what I did this week. I was on every day. That's not always the case, but Monday I was on Good Morning America with my wife, who has a new cookbook out that she wrote for the American Cancer Society. And so it was on healthy eating. And it was the first time I've done a cooking segment, which was a lot of fun. She made a steak burrito bowl, and we talked about how much sodium was in that compared to what you get if you get one at a chain restaurant. On Tuesday, I was on talking about exercise and type 2 diabetes, and the question, a paper had come out showing that although 30 minutes 5 times a day is what's recommended, if you do more than that, it will actually, people who do more than that had lower risk of diabetes than people who just did 30 minutes. Well, I kind of turned it around and said, well, if you look at the data further, it also found that even if you do 10 minutes a day, that's enough to lower your risk of type 2 diabetes. And so I wanted people to not be scared off by the idea that I don't have 30 minutes 5 times a day, why should I even bother? The message I wanted them to have is every little bit helps. On Wednesday, I was on talking about concussions. And the big news on Wednesday was that there was a new study out that found that having children locked away in a dark, quiet room after concussion for 5 days does not lead to better outcomes. It leads to actually worse outcomes in terms of mood. Well, I told the producers, I said, you know, this study, it's a great study, was done in Wisconsin. It came out about 2 years ago. It's not really news. They said, well, the Wall Street Journal wrote about it on Wednesday. So oftentimes, when another form of media picks something up, it becomes news and it's an opportunity for me. So I got on and I talked with the anchors about concussions and what you do. And I was on with Michael Strahan, who's a former all-star football player from the New York Giants, and Robin Roberts, who was a college basketball player, and she talked about her experience with concussions as well. And it was a way to get viewers to relate to this information in a personal way. Thursday, I did a segment on local TV. I have a segment called Tell Me the Truth, Doctor. The first question was about a cluster of MRSA infections at a local high school, and I talked about how you can reduce the risk of MRSA transmission in locker rooms and gyms. There was the CDC report on STDs, and I talked about why it's so important to talk to kids about using condoms, that even if they're on a long-acting contraceptive, that does not prevent chlamydia, gonorrhea, or syphilis. And then the last question was my favorite question that I've ever gotten through this. I go out on the street with my iPhone and I ask people, you know, if they have a question they'd like me to answer on the air. And this woman said to me, I think she was about 70 years old, she said, yeah, I have a question for you. She said, every day I eat 200 to 300 packets of Splenda. Is that okay? So I have medical residents who work with me every month, so I put them on that question to research. Well, actually, it probably isn't dangerous, but the upper limit of daily consumption, according to the FDA, should be 23 packets if you weigh 132 pounds. So anyone out there so I told my wife that this question was asked, and she said, how does she eat 200 to 300 packets a day? And I said, oh, I don't know. And she said, you didn't ask her that question? And pretty much everyone I've told about that question asked the same thing. And so when I was on the air, I said, if you're out there, please get back to me. Everyone wants to know, how do you do it? So then Friday I was just on yesterday talking about the new AAP guidelines on media and kids. And it was terrific. It was, you know, and for those of you who are coming to the workshop on communication after this, I'm going to talk about this in more detail and talk through how do you distill this down. So 30 pages of materials that the AAP put out. Terrific stuff. I had to distill down to 1 minute and 45 seconds. So as you think about that, and as you think about how do you talk to your patients about this, where you have a limited amount of time, what do you pick and choose from there? What's the message that you want to give to your patients about something that was very important? And it was a lot of fun doing. So in addition to traditional media, I'm a big fan of social media. And the reason for that is that you need to reach people where they are, where they get their information. And if you're looking to reach younger generations, They are not watching our shows. Is this being videoed? Not all of them are watching our shows. No, our demographic is much older, and a lot of people are getting their information on social media, and so that's where I spend a lot of time. Every week I host a Twitter chat. It's called ABC Dr. B Chat. This Tuesday, just a few days ago, it was on flu prevention. So we had, the AAP was on that, CDC, FDA, Health and Human Services, we had nurse practitioners, major medical centers were all there. We talked about why you should care about flu, what's the vaccine recommendations, why flu mist is not recommended this year. And here are the numbers. There were 868 active participants. In the course of an hour, there were 2,600 tweets, and these reached a potential audience of 49 million. 49 million people who might get a tweet that says, you know, the time to get a flu vaccine is now. You know, even healthy people need to worry about flu. And you wonder, 140 characters, how can you say anything that's of value? Well, a lot of it is the information you link to, and that's where you can share more of that information. When I go on the road, I do Facebook chats. I was in Brazil twice this year reporting on Zika. Once I did a 45-minute Facebook live chat with a neonatologist from the main hospital in the hub of the heart of the outbreak to talk about what they were seeing with Zika. I did the same thing in Miami when they had their first cases with an obstetrician there who was seeing people. My favorite Facebook chat was in August, where I did a Facebook live chat with Commander Jeff Williams and Officer Kate Rubins, the two Americans on the International Space Station. And I was talking live to them from New York, and they're floating around in this capsule. It was absolutely incredible. We talked about why she was sequencing bacterial DNA in the air and in a spaceship, and what the value of that was. But the most interesting thing to a lot of our viewers, because it came up in the Facebook comments, is if you watch this, and you can Google it and watch it, her hair has a life of its own. So she's in zero gravity, and she's got this ponytail, and it's just kind of going, and it was really cool. And she gave us a tour of the space capsule. Definitely check that out. So in my last couple minutes, I want to talk about why pediatricians are so well suited to dealing with this and to being TV doctors and to engaging with the media. By our very nature, we're influencers. We usually are sitting with a patient and a parent and a guardian. With our words, we explain, we comfort, we reassure, we educate, we shape behavior, and we inspire. And that's exactly what I try and do when I'm on the air. When I look at that camera every time, I'm looking and I'm imagining that I'm seeing either one of my patients or one of the parents. And that's the tone I use when I'm on the air. And that's why it's so important that you take those calls. You know, so many of the factors that we're dealing with in the lives of children, in their health, are outside of that exam room. And we need to address that. Dr. Dreyer just nailed that. These are things taking place in their homes, in communities, in schools, things related to policies. And media is a way to address that, to address the social determinants which are so critical to health. You know, I trained at Hopkins in the 80s when Janet Serwent was there, and Frank Oski was my director, and he taught us the importance of asking questions, to challenge the status quo. When you see things that don't make sense, to ask why and to dig deep. He talked about us working to change the lives of children any way we could. And he said the true pediatrician is an advocate. And that's something I've tried to do throughout my career, and I try and do it when I'm practicing public health and pediatrics in front of a camera. So when there's an issue that you care passionately about, try using the media as part of your soapbox, as a way to connect with people and to make a difference. You know, you are pediatricians, and people want to know what you have to say. Thank you very much.
Thank you, Dr. Besser, for that excellent keynote presentation in keeping with our PEDS 21 theme of communications and media. So speaking of connections, Dr. Besser used to live in my neighborhood when he was still at the CDC in Atlanta. And when I lived in San Diego, I actually worked with his brother at a birthing center. His brother is an OB. So really such a small world that we live in. And it's great to know people personally as well as we're all getting to know each other and connecting personally and virtually.